Hi, good morning, friends. I welcome you to ENT department. Today we'll talk about history taking in ear, nose, and throat diseases. First of all, before taking history, I want to advise you regarding the language. We have to take the history in the patient's known language or in the mother tongue, patient's mother tongue, so that patient can express their feelings, their illness in proper way, and we can understand it in a proper way. And second thing is always right, right or left side of the body, because God has given us two nostrils, two ears, two tonsils, right and left side of the throat, neck, everything. Because right and left always insist, I insist on writing it properly. This is the most important thing. Now we have to ask the patients thoroughly, so that most of the times if we take proper history, 50% of diagnosis is already done. To give you for some examples, I will tell you that if the patient gives history of discharge from the recurrent discharge from the ear with hard of hearing, whenever patient gets the cold, that time there will be discharge from the ear. Then our brain thinks about chronic suppurative otitis media. One more example is if the patient starts getting giddiness, if it is above ear, reverse wise, up, down, if we change the position of the body, suddenly patient starts feeling giddiness. Then our brain thinks about benign paroxysmal positional vertigo because of change in position. Now, one more example with history alone, we can come to some part of diagnosis is if the patient gives history of sneezing attacks, continuously hundreds of sneezes, watery rhinorrhea, nasal obstruction, and this happens recurrently and while working in a dusty area or while cleaning the house. And if the history is like this, then our brain thinks about allergic rhinitis. Now, coming to the disease, we have to go for other histories also, that is personal history and past history, family history. To give one more example of family history is one patient was brought to me with congenital pre-auricular sinus and it was infected. That's why they have brought to me. Now I inquired about the father. Father also had similar congenital preauricular sinus, and I inquired about the grandfather of the patient, and I called all the three generations: grandfather, father, and the patient child, so that all the three generations, the patient, they were suffering with congenital pre-auricular sinus. This is a good example. Now we have to go for other things. I will show you them in the slides. Whenever the patient says regarding the ear complaints, I have given you one common examples. Example is pain in the ear. Then we have to think about ASM, hard of hearing. Usually common this thing is wax or fungus. Ringing in the ear, ASOM, retraction of the tympanic cold, and whenever patient get giddiness, that is BPPV, itching in the ears, then foreign body wax and otomycosis, swelling of the pinna and change in shape of pinna. Then we have to think of contact dermatitis and hematoma of the pinna and history of trauma to them. We have to take all these for histories. After recording of the nasal complaints of rhinorrhea, nasal obstructions, bleeding from the nose, or post-nasal discharge, headache, that is all sinusitis or something else. Now, major problem nowadays is snoring. Snoring which leads to sleep apnea, and hence I insist on going more and more so that we can treat the patient, because nowadays a lot of patients are obese, overweight, and they snore regularly, which will affect their whole system, not only our ear, nose, and throat, which will lead to uh, cardiovascular, which will affect the cardiovascular system also. Dear friends, even though diabetes, blood pressure, heart disease are put in past history, but usually it will be continued in the present history along with the present complaint, present illness. It will be part of the one of the diseases which will go on, and only a few people will get cured from diabetes and blood pressure. But few of the heart diseases, what are the treatments they have taken, we have to always write it down. And whenever there is a history of allergy, the allergy, because unless they go for anti-allergic vaccination, and it will also go on in the lifelong. And congenital disorders, as you know, that from by birth they are coming. That's why, and in personal history, and they might have been smoking long about for 10 years, 20 years, then my left smoking for about 10 years. And it is all that like that. All the habits we have to mention it properly. Dear friends, now we have finished history taking. Now we have to go further. After history taking, we have to go for clinical examination of ear, nose, and throat. Total and neck also. We have to see the patient as total ear, nose, throat, head and neck. Now, to tell you the main things is, now to know the to get the notification of my future videos, please subscribe my channel and press the bell button so that you will get the notifications. Next video will be on how to clinically examine ear, nose, and throat. Till then, goodbye.